In this video, we will be seeing about the anatomy of one of the important part of the male external genitalia, that is the penis. Before going into the proper topic, let's understand some of the bony anatomy of this particular region. So this diagram shows the sagittal section through the pelvis. So this will be the hip bone. This is the sacrum, section through the sacrum. This is the arcuate line iliopubic eminence, and here we have the pecten pubis. This will be the area of pubic crest and pubic tubercle, and this is the pubic symphysis. This is just for orienting you to this particular view. Our focus lies over here. This is the inferior pubic ramus, and this whole area will be the ischiopubic ramus. This is the ischial tuberosity. This is the inferior as border of the ischiopubic ramus. Now if you look at this particular diagram, this is the anterior, not exactly anterior, this is simply the anterior-superior view of the pelvis, bony pelvis. So this is the ischial tuberosity, this is the area of symphysis pubis, and this is the area of ischiopubic ramus. This is the lower border of ischiopubic ramus. And now we are going to look at this particular bony pelvis from the inferior aspect. This is that particular view. This is the inferior surface of pubic symphysis. This is the everted edges of the or everted lower border of the ischiopubic ramus. This is the ischial tuberosity. Now we will move on to see our topic of concern, that is the penis. The penis, it forms the male organ of copulation, and mainly it consists of two parts, a root and a body. So this diagram is actually tough to understand for a beginner. So I will just explain this diagram. What is this view? This view will be basically from the inferior aspect. Here we can see the ischiopubic ramus. Inferior border of the ischiopubic ramus is clearly shown over here, and this is the ischial tuberosity. So what we are seeing over here is actually this view. We will get this view only after removal of the skin and superficial fascia of this area, and the superficial fascia of this area is termed as the collis fascia, which is the continuation of the membranous layer of anterior abdominal wall. We have removed the skin and the collis fascia. Now we can see this particular contents in this space, and this space is actually the superficial perineal pouch. And as we already know, the deeper aspect or inner aspect of the superficial perineal pouch is bounded by a membrane. Part of that membrane is visible over here, whitish structure over here, that is the perineal membrane. This perineal membrane is very important to identify the differentiation between superficial perineal pouch and deep perineal pouch. So if you remove the structures over here, we will be able to see the triangular perineal membrane extending between the two ischiopubic rami mainly. Okay, now we are moving on to see the structure of the penis, and as we said, it is already having two parts, the root of the penis over here, and we have the body of the penis over here. The root, that is this area, it is consisting of two parts, two type of parts, or mainly three parts. So this is one part over here, and you can see the analogous corresponding part over the other side also. These are the diverging crura of the penis, and in the median area you can identify this dilated area, that is the bulb of the penis. Now as you can clearly see, this root of the penis will be located in the superficial perineal pouch. We will focus on the crus of the penis. Each crus, you can focus over the crus over this particular side. This crus is attached to the inner aspect of the everted ischiopubic ramus. We have seen the ischiopubic ramus over here. We can see the attachment clearly in this region, and this attachment is lying in front of the ischial tuberosity. This is the ischial tuberosity, and this attachment is lying in front of it. Now What happens if we trace this crura anteriorly? We can trace this two crura into the anterior aspect. Now we can see they are merging to form a common structure, and this common structure over here is known as the corpora cavernosa. As we have seen the bony anatomy of this area, we have clearly understood this is the inferior view. So what we are seeing here is actually the ventral aspect of the shaft of the penis. So this corpora cavernosa, as clear in the diagram, it is lying on the dorsal aspect of the penis. Now this is a section through the shaft of the penis. Here you can focus on this particular merged corpora cavernosa. We will come to that details of the shaft later. Now we will focus on the bulb of the penis. This bulb of the penis is expanded and it is attached to the deeper lying perineal membrane. We can see the parts of perineal membrane, this white structure over here. Clearly the attachment of bulb of the penis is shown in this particular diagram. And this bulb, if you trace it anteriorly over here, it is continuous with the corpus spongiosum of the penis, and this is the corpus spongiosum. As we can clearly see in the diagram, the corpus spongiosum of penis is actually lodging in a groove over the ventral or under surface of corpora cavernosa of the body of the penis. This is the body of penis. This is the groove over here. You can see the corpus spongiosum located in this particular groove. I want to clear 2 points over here, that is the covering muscles of the bulb of penis and the crura of the penis. So in this diagram over here, you can clearly see the muscles that are covering this area. One muscle is bipennate, which is lying in the midline, and other muscle will be lying on the side covering the crura of the penis. The muscle that is lying on the side, which is covering the crura, will be known as the ischiocavernosus muscle, and the muscle that is lying in the midline, which is covering the bulb of the penis, will be known as the bulbospongiosus muscle. As you can see, it is bipennate. Now this is a sagittal section through the male pelvis and the male external genitalia. We can identify the position of the penis in this diagram over here. This is the area of the root of the penis. This entire area will be the body or shaft of the penis. In the root of the penis, this area will be the bulb of the penis, and as we can clearly see, this structure, this is the urethra. The urethra, it enters into the bulb through the upper surface, and it enters into this bulb only after piercing this fibrous membrane over here, which we have seen already in the first slide or first slides. That membrane will be the perineal membrane. So the urethra, it comes down, it pierces the perineal membrane, and it enters through the upper surface of the bulb, and it forms a dilation or expansion over here, which is known as the intrabulbar fossa. And this intrabulbar fossa, usually it is, if you take a cross section of that fossa, it will look like a trapezoid in shape. Before going further, we will understand this particular structure. This is the perineal membrane that we have mentioning in the first two slides. So it is roughly triangular in section. We will be getting this view only after removal of the contents in the superficial perineal pouch. I want to focus on this particular area where an artery piercing the anteriormost aspect of the perineal membrane on either side. This is the deep artery of penis. And if you take the section through the body of the penis, this is the corpora cavernosa, and in the roughly in the middle of the corpora cavernosa on either side you can see an artery. This artery will be the deep artery of penis. So after piercing this perineal membrane, this artery is entering into the substance of corpora cavernosa. In the flaccid state, the body of penis forms a cylindrical pendular structure which passes downwards and forwards, and it also make an angle with the root. But during the process of erection, the penis is directed upwards and forwards and becomes prismatic on cross section with the rounded angles. In human, these are the upper surface. This is the upper surface of the shaft or body of the penis. This is the lower surface of the body of the penis. This upper surface is also known as this one, dorsal surface. This lower surface is also known as the ventral surface. And we are using this description only to maintain a similarity of disposition of penis in quadruped animals. We will focus on the structural details of the penis in the next slide. So this is the view, and we have taken a magnified view at the tip of the shaft of penis. We can clearly see there is an expanded conical mass at the tip of the body of penis, and this structure is known as the glans penis. This glans penis is covered to a variable extent by this particular fold of skin over here, and this fold of skin is known as the prepuce or foreskin. This is the sagittal slit of the external urethral orifice, and it is situated close to the tip of the glans penis, which is very clear in this diagram. When the prepuce is retracted, as we have shown in the figure, the base of the glans penis over this area, you can see this is the base of the glans penis. This base region presents a raised margin. This raised margin, this one, is known as the corona glandis. And just behind the corona glandis, there exists a circular sulcus over here. This circular sulcus is known as the neck of the penis. The corona glandis and neck of penis are provided with numerous sebaceous glands which secrete a material known as smegma, and it emits a very peculiar odor. The potential space between the prepuce, which is retracted over here, and the glands, which is known as the preputial sac. Now, for completion's sake, we can see a connection between the undersurface of the glands over here and the prepuce. This connection is known as the frenulum, and this frenular attachment is extending from the base of the glands of penis till the external urethral orifice. Now we will be focusing on the body of penis, that is this particular region. This is a section through the body of penis. Body of penis is composed of three fibroelastic cylinders, a pair of dorsally lying corpora cavernosa and an unpaired corpus spongiosum on the ventral surface. This is the section through the shaft. We have seen this diagram already, and as you can clearly see, this is the corpora cavernosa on the dorsal aspect, this is the corpus spongiosum on the ventral aspect. This corpora cavernosa, this here, these are separated by an incomplete vertical partition. We can see that here. This partition is known as septum pectiniforme. And if you focus on each corpus cavernosum, it will be divided by a number of trabecular septa into numerous intercommunicating cavernous spaces which are lined by endothelium. That is clearly depicted here. The cavernous spaces receive the blood from the capillaries of helicine arteries and are drained by the radicals of deep dorsal vein of penis. We can see the deep dorsal vein of penis in this section over here. The coiled helicine arteries, which is providing the blood to the penis, they are the branches of the deep artery of penis. We have seen the position of deep artery of penis already within the corpus cavernosum. So they gives of the branches helicine arteries, and these helicine arteries, they will be passing through the trabecular septa. And now we are going to explain the physiological phenomenon of erection. In the flaccid state of penis, the cavernous spaces which we have seen over here, they remain practically empty because of the venous egress is more than the arterial ingress. That means arterial blood flowing to the corpus cavernosum is very less when compared to the venous blood that is flowing out of the corpus cavernosum. And during erection, what happens? These helicine arterioles, they dilate and the cavernous spaces will be filled with blood. At the same time, the venous outflow is diminished by the pressure of the distended cavernous spaces. And this makes the penis erect and turgid. Therefore, we can clearly say erection is purely a vascular phenomenon. Traced to the front, corpus cavernosum over here, it will end in a blind conical extremity. We can see the conical extremity over here, and which is extending up to the neck of the penis, this region. It will be overlapped by the corona glandis also. Now we focus on the corpus spongiosum, and this corpus spongiosum is positioned over here. It is traversed by the spongy part of the urethra. And when you trace the corpus spongiosum anteriorly, it is expanded to form the glans penis, and if you trace it posteriorly, that will be forming the dilated expansion, the bulb of the penis. Now we will look at the coverings of the penis. From outside inwards, the penis contains mainly three layers: the skin, the layer of superficial fascia, and this particular layer, that is the fibrous envelope. First we will see the skin. It is thin, dark in color, loosely envelops the structures, and is devoid of hair except occasional coarse hairs at the root of the penis. And at the neck of the penis, the skin is reflected forwards over the glans penis as the prepuce. We have already seen that. A median raphe will be present on the ventral aspect. Now the second layer, that is the superficial fascia. We can see the superficial fascia clearly over here. This fascia is differentiated into an outer loose areolar tissue. You can see this loose areolar tissue, and a deeper or inner well-defined membrane that is known as the fascia penis. You can see the fascia penis over here. It's not this white line, just outer to this. That is the fascia penis. The areolar tissue is devoid of fat, extends into the substance of the prepuce, and it contains on the dorsal surface an unpaired vein. That vein is that particular vein, that is the superficial dorsal vein of the penis. This is that particular vein. Now the deeper layer, the fascia penis, extends up to the neck of the penis. So you can look at this particular diagram. This is the corpus spongiosum and this is the corpus cavernosum. Covering the corpus cavernosum and spongiosum, there is a fibrous layer. So anteriorly, the fascia penis extends up to this neck region, and there it blends with the fibrous sheath of corpora cavernosa and corpus spongiosum. And proximally, if you trace it over here, this fascia penis is continuous with the scarpa's fascia of the anterior abdominal wall. That is the membranous layer of superficial layer of the anterior abdominal wall. And when you trace it towards the scrotum, this fascia will be continuous with the dartos muscle of the scrotum. Now this is a view of the penis after we have made a cut in the middle of the shaft of penis. We can see the magnified view over here. So this is the dorsal view of the penis, and you can identify mainly some structures are arranged in order on the dorsal aspect of the penis. So from the midline laterally, from the middle to the lateral side, these structures are arranged as there is an unpaired deep dorsal vein of penis over here, and on the side of that we can identify a pair of dorsal arteries, these arteries, and further laterally we have a pair of dorsal nerves. So these are arranged on the dorsal surface beneath the fascia penis. Now we will be focusing on the fibrous envelope, which is known as the tunica albuginea. It invests separately the corpora cavernosa and corpora spongiosa. You can see the corpora cavernosa over here. This is the corpora spongiosa. We can see that this fibrous layer separates the spongiosum and cavernosum separately. Now, the tunica albuginea of the corpora cavernosa over this area, it consists of superficial longitudinal fibers and deep circular fibers. And a fibrous partition extends from the tunica albuginea, and that is arising actually from the deep fibers of the tunica albuginea, and that intervenes between the two corpora cavernosa. If you trace on the posterior aspect of the pineal shaft, it is this partition arising from the deeper layer of tunica albuginea is complete. But when you trace to the front, we can see that it is incomplete. So this incomplete partition, which we have heard the name already, that is known as the septum pectiniforme. And from the tunica albuginea, this is the tunica albuginea, numerous trabecular septa containing fibroelastic tissue and smooth muscle project into the substance of the corpora, and it divides them into cavernous spaces. You can see the cavern-like spaces in both of the corpora cavernosa over here. These spaces are produced due to the numerous septa arising from the tunica albuginea. Now we are moving on to see the ligaments of the penis. The two ligaments, the fundiform and suspensory ligaments, they suspend the body of the penis from the symphysis pubis, and the fundiform ligament is superficial to the suspensory ligament of the penis. First, we will see about the fundiform ligament. So this is the area of the anterior abdominal wall, and here is the area of linea alba, and this structure over here will be the fundiform ligament. It is continuous above with the linea alba, as we can see, and below it splits into two layers. We can see the splitting over here, splitting into two layers, and they extend by the side of fascia penis. Here, this is the fascia penis, and you can see the two layers extend over the side, and it is continuous with the septum of the scrotum below. That is all about the fundiform ligament. Now the deeper lying ligament, that is known as the suspensory ligament. So this is the suspensory ligament over here. It is triangular in shape, and the apex of this triangle is attached to the symphysis pubis over this area, and its base that blends with the fascia penis. You can see that over here on the dorsal surface and also along the side of the penis. So these two ligaments are important to maintain the position of the penis. Next, we are going to see the arterial supply of the penis. The penis is supplied by three paired arteries: arteries to the bulb, deep arteries, and dorsal arteries. These arteries are the terminal branches of the internal pudendal artery, which initially lie in the deep perineal pouch, and they pierce the perineal membrane before entering the root of the penis. So in this figure over here, we are actually seeing the deep perineal pouch. The perineal membrane has been removed. So we can see the arrangement of the arteries clearly in this diagram. So arteries to the bulb, they supply the corpus spongiosum of the penis and spongy urethra. And deep artery, we have seen the course of the deep artery already. They will be lying within the substance of corpora cavernosum, and they will be dividing into many small branches, the Hilsian branches, and they will be breaking up into capillaries. Finally, they will be giving of the blood into the cavernous spaces within the corpus cavernosum. Now about the dorsal artery. This is that particular dorsal artery. This is the position of right and left dorsal artery. And it runs along the dorsal surface beneath the fascia penis that we have already seen. and it supplies the skin, prepuce and glans penis. We have to remember this dorsal artery also giving branches to the corpora cavernosum. So corpora cavernosum, when you consider the cavernous spaces within this, they receive blood both from the deep artery as well as from the dorsal artery. The venous drainage of the penis, it is drained by two sets of unpaired veins. They are the superficial and deep. So this will be the position of superficial dorsal vein of the penis, and this is the position of deep dorsal vein of the penis. The superficial dorsal vein, they receive the blood from the prepuce and the skin of penis and drains bilaterally into great saphenous veins. The deep dorsal vein begins at the base of the glans penis and receives blood from the same glans penis, and they drain into the prostatic venous plexus. Now, regarding the nerve supply of the penis, so we will have somatic nerves, parasympathetic nerves and sympathetic nerves supplying the penis. The somatic nerves, they are derived from the dorsal nerves of penis, which are branches of the pudendal nerve. They convey pain fibers from the penis and urethra. Next, the parasympathetic nerves, they are derived from the pelvic splanchnic nerves, the nervi urgentes, which convey preganglionic fibers from S2, S3 and S4 segments of the spinal cord. The parasympathetics act as vasodilator fibers by liberating nitric oxide at postganglionic endings. The third group will be the sympathetic nerves. They are derived from superior hypogastric plexus, conveying the fibers from the lumbar segments, and they will reach the penis via the pudendal nerves and their branches. The sympathetics supply vasoconstrictor fibers, and there will be certain developmental anomalies in relation with the penis. There will be phimosis, hypospadias, bifoot penis. That all things will be dealt in detail in the development of urogenital system. So, in nutshell, that was in general regarding the anatomical structure of the penis. Thank you for your patient listening.